Right. South Africa is expected to start piloting the HIV prevention injection next year. Recently, the Spotlight reported that the Wits Reproductive Health and HIV Institute and the National Health Department are expected to begin providing the injections of the long-acting formulation of the antiretroviral to young women early next year. The HIV prevention shot is expected to be offered alongside 2 other forms of HIV pre-exposure pills, commonly known by its brand name Truvada, and a relatively new vaginal ring to prevent infection inserted at home. The monthly ring was found to reduce women's risk of contracting HIV by between 27% to more than half. That's according to the World Health Organization. Now, for more on this, we're joined by Mia Malan, Editor-in-Chief at Bhekisisa. Very good afternoon to you, Mia. Thank you so much for your time. Some interesting developments, especially as we go into, celebrating and marking World AIDS Day on the 1st of December, and also on the back of what we've been hearing around the impact of COVID-19 on HIV/AIDS patients. This is a fantastic development, but of course there are still a lot of a lot of grey areas as to how it will all work, how much it will all cost.
Yes, I think there's a lot of excitement in the HIV world about the injection. You take it once every 2 months, and it works with an antiretroviral drug. So it's the same medicine that people with HIV use, and that medicine then prevents HIV from entering your cells. Now, the important thing to remember is this injection is for HIV-negative people, so you need to have an HIV-negative test. And yes, you are correct. There are huge issues around the price of it, because right now in America, where they're already using this injection, it sells for 54,000 rands for one injection, and you need 6 of those injections per year because you need to take it once every 2 months. It's really effective. It virtually wipes out your chances of contracting HIV through sex. So what's happening in South Africa now, what is going to happen is, yes, you're correct, there will be pilot studies early next year, but the big thing is when will we start to roll it out en masse? So what's going to happen now is there's a special committee that advises the health minister, and they will now look at a cost-effective analysis to see what price will make sense for South Africa. The company Viv Healthcare that makes the drug has committed to drastically reduce the price for poorer countries, and South Africa is one of those countries that they've included in their list. But that price has not yet been announced, and the controversies around the price is that some studies in South Africa show that we shouldn't pay more than twice than what we pay for the HIV prevention pill. And that would translate to we shouldn't pay more than 240 rands per injection, otherwise it's not going to be cost effective for us. And the big question is, would that price be as low that Viv Healthcare would offer?
Yeah, that's an important question. But as soon as those processes have been dealt with and there is some clarity going forward, what do you imagine to be some of the challenges that will come with this? It's a major breakthrough, but you say that it's for people who are HIV negative and who will have to undergo this course. Perhaps talking to 2 questions in one. Also maybe speak to us about who exactly will be prioritized going in to get this pill.
So let's start with your second question, who will be prioritized? When the health department rolled out the HIV prevention pill, it started with what they call key populations. And that's just a technical word for groups of people who are more vulnerable to contracting HIV. Those groups include people like sex workers, like men who have sex with men, but also in Africa specifically, young women between 15 and 24 years. That group of women is the group among which HIV is increasing the fastest at the moment, and that we really, really want to reach with this injection. So what challenges would we experience? Well, to get healthy people to a clinic for an injection every 2 months, we are going to have to do serious marketing for it. We saw with the HIV daily poll when we rolled it out that the uptake wasn't nearly as high as we expected it to be, because People didn't know about it to start off with. They felt it was stigmatized because it was so heavily promoted among key populations. So one of the things that we would need to try and do a bit differently here is to not stigmatize it, and to also make sure that that the health department has effective communication so that people do know about it. The other challenge is once you have people on the injection, how do you get them back to the clinic every 2 months? Because the injection only works if you take it. So one of the things that they're looking at is for young women specifically, it would be great if we could give them an injection when they also come for contraception to the clinic, because then it's an all-in-one thing and they would most likely, regularly collect their contraception. In South Africa, though, the most common form of contraception in the public health sector is an injection that you take once every 3 months. Now, the HIV prevention injection you only take once every 2 months. So there are studies that they're looking at to see if this injection, the prevention injection, could possibly be taken once every 3 months. And there's some early good news about it. When they did their trials to look at the 2-monthly injections, they did it during COVID, and there were periods during which people couldn't really, the trial participants, get to the clinics to get the injections. So there was a small group of 200 women that they allowed to take it later, generally with a 3-month interval. And they didn't see more infections in this group than in the rest of the trial participants. But that is a very, very small group. So we would first need to see what larger trials say.
Yeah. How much do we know about the common side effects of this jab? I mean, we, for instance, will hear of women who take the contraceptive, the injection over that 3-month period, speaking about water retention being a huge issue. But in terms of the HIV jab, how much do we know?
What we know is that the most common side effect of it is pain at the injection site. So there's a bit of pain. It's actually a relatively large injection. It's, for instance, if you're going to compare it to COVID vaccines, there's more fluid in it that you would need to get into someone's body than with a COVID vaccine. But the studies have shown that while it initially could be relatively painful, you get it in your buttocks. You can't get it in your arm because it is so large. While it's initially quite painful, that pain decreases over time the more injections you take. There aren't any serious other effects. There is, however, a concern that this antiretroviral that's in the injection, it's called Cabotegravir, it falls into the same category of antiretroviral drugs that people in South Africa use. It's a drug called dolutegravir, and if you then do happen to get infected along the way, despite the fact that you took the injection, it could mean that when you eventually have to get antiretroviral treatment because you're infected, that dolutegravir drug wouldn't work as well for you. But the good news is that we've seen so few infections in trials that is likely not a huge concern.
Does this jab have the ability to perhaps change the trajectory of HIV infections? I mean, as you speak about that 15 to 24-year-old group, I mean, that is essentially the future of the country.
Absolutely, and there's good news about it. Most HIV scientists think, yes, it will be a game changer, not by itself, in combination with all the other methods, for instance, the vaginal ring or the daily pill that we have. Because research shows us, if we compare it to contraception, that the more choices you give people to choose from if you want them to take up either contraception to prevent pregnancy or an HIV prevention method to prevent infection, that they are far more likely to use one of those methods if they have choices. Now, specifically in the case of the injection, modeling studies have shown us that this injection could prevent up to 52,000 annual infections in South Africa. Now, that is a significant amount because at the moment we have about 200,000 new infections each year. So up to a quarter of those infections can be prevented. And if you look at the 200,000 new infections in our country each year, 130,000 of those are among young women between 15 and 24. And the good thing about the injection is that in the trials that they did, it showed us that people adhere to it very, very well. They did come to the clinic every 2 months. And the current method that we have is the daily pill that you can use. There's a problem with adherence. People find it hard to remember to take the pill each day at the same time, because sometimes they may not be at home when they need to take it, or they feel they may need to hide it because people may think they're sick and already have HIV. So the good thing about this injection is that scientists think the reason why it works better than the pill is largely because it's so much easier to adhere to.
Very well. Thank you so much for that breakdown. Mia Malan, Editor-in-Chief of Bhekisisa, giving us a sense of what this HIV injection could look like in the future. Now,